Okay, so see if you can pull up your PowerPoint,
Okay. So I should share my screen.
please.
Okay, let's do this one.
Yep, it's coming up.
You can see it?
I can see it. Okay, and
Perfect.
you can advance it, right? The next slide.
Let me see. Can you see that?
Yes. Okay, so
Awesome.
you can advance it. Good. So what I do is I introduce you um, by going over your CV that you sent me, your little brief bio.
Okay.
And I go off camera, so you'll see a still picture that looks like that. And then
Okay.
talking so that you can get the spotlight on you because you're speaking. You can speak up to 45 minutes to an hour if you have that much to do. And we take questions. I'm looking at the chat to see if people are actually it's the Q&A to see if people are putting questions in while I'm off camera. And
Okay,
that's
that would be
how it
great.
works. Okay.
Okay.
That's pretty simple. So,
Yes.
okay. Well, I'm ready for you. What I will do at 12 noon,
Mm-hmm.
a countdown. I'll just do 5, 4, 3, 2, 1. I'll press start so you don't have to press start. Um, where is start? Just realized that. Um, hmm, it's recording. Okay, and we'll start at 12 noon. So let's
Okay, sounds good.
start at about 2 minutes, 11:58.
Perfect. Okay. Thank you so much, Annette.
And don't shut off everything. Just close out your audio and your video.
Okay.
Then come
I
back.
can do that. Okay. See you
Okay.
soon.
Thank you. Bye-bye.
That is so weird. It looks like I'm logged on twice. Hmm.
Okay, I'm back. Okay, got a minute. And
All
then
righty.
I'll welcome everyone after I count down and sign in. And what's weird about this, I usually have a start button and I don't see it. So I'm wondering if we're already signed in. But anyway, let's do it's 12 noon, so 5, 4, 3, 2, 1. We're in. And I'd like to say welcome to everybody. Welcome to our 2026 Lunch and Learn series. We're very excited to have you join us today. We have a very exciting speaker from DeKalb Public Health Department, and I'd like to introduce her. Before I do, I just want to comment and say, if you do have questions, we will take your questions at the end of her presentation. And so let me tell you a little bit about her first. Miss Taylor Green. She serves as the Maternal and Child Health Community Outreach Coordinator at DeKalb Public Health, where she supports families through coordinated outreach, health education, and connections to programs such as WIC, Babies Can't Wait, Children First, Children's Medical Services, Adolescent Health, and Youth Development. She is completing her Master's of Public Health at Rutgers School of Public Health with a concentration in urban global public health. Taylor also serves in the National Public Health leadership role through the American Public Health Association and in the 1000 Dreams Fund, where she contributes to student engagement, policy discussions, and maternal health advocacy. Her work is grounded in a commitment to improving family well-being, strengthening community partnerships, and advancing equitable outcomes for parents and children in Georgia. Please welcome Taylor Green. Taylor, take it away.
Hello, everyone. I'm so happy to be here and kick us off for the first Lunch and Learn series of 2026. I hope everyone is having a great start to the year. So I'll go ahead and get started. Let me share my screen. Oh, and then it looks like it might be disabled again.
All right, let's try it again.
Okay.
One moment. Okay, now try.
Ready, here we go.
There you go.
Right. Can everyone see that okay?
It's coming up now. Yep.
Awesome. So again, my name is Taylor Green. I'm so happy to be here. I am the Maternal Child Health Community Outreach Coordinator at DeKalb Public Health. DeKalb Public Health has 5 locations: T.O. Vincent, where I am at, off Windway in Decatur; the main building, which is Richardson; east, which is Stone Mountain, Lithonia; north, off Claremont Road; and Clifton Springs, which is off Flat Shoals. So all of our clinics offer different services, and maternal child health, I'm going to go over a little bit more of what we do and specifically what I do. Definition of maternal health. So maternal health refers to the health of women during pregnancy, childbirth, and the postnatal period. Each stage should be a positive experience, ensuring women and their babies reach their full potential for health and well-being. One of the major things we focus on is prevention, right? Because prevention is key. If we address issues early on, we increase, positive experiences for mother and baby. Everyone, including myself and you all, we're all on our own growth path, right? And we want to reach our maximum potential. So if we're seeing any issues or just differences in the stages of our children or mothers, we want to hurry up and prevent those through intervention. Definition of child health. Child health encompasses the physical, mental, emotional, and social well-being of children from infancy through adolescence. Children cannot achieve optimal health alone. They are dependent upon adults in their family and community to provide them with an environment in which they can learn and grow successfully. So that's what we're here for, right? We want to make sure that all of our children are reaching their optimal health. There's no one two child alike at all, even in the same family. They all have different needs and the way they see the world. So if we can address issues early on, the better they'll be. All of our programs, I'm going to go over them, but they do cover from pregnancy all the way up to children age 21 who may have chronic conditions. Our goals, objectives, and programs. Our goal is to improve the well-being of mothers, infants, and children. Their well-being determines the health of the next generation, which is very important. Objectives, we want to educate and empower families. I do that through health education on various topics, promote the birth of healthy babies. That's very important that pregnant mothers are going to their prenatal appointments and postnatal appointments. Encourage babies' social development skills, implement proven interventions and strategies. Again, that is very, very, very key. The earlier, the better. And also provide education and resources and improve community engagement. That's why I'm here today, to let everyone know our services, where we are. So if you have any family in mind or in the community who are in need or looking for resources, you know where to go. So program eligibility, we do have 6 programs. A lot of different programs, they all have their own priorities, goals, timeline, funding. So I know it could be a lot of information, but through this presentation, I'm just hoping to give an overview. And that way, if you do encounter a family out in the community who's in need, you basically have somewhat idea of what we do, and you can tell them about it before you link them to us, okay? So the first one is MORE program, Mothers Offering Resources and Education. So it's for pregnant mothers and those who have just given birth up into under 1 year. The most common one I think that people really know about, which is WIC, Women's Infant and Children. That is from pregnancy up to the child's 5th birthday. And then we really have an umbrella program. It's called Children First, which is early intervention programs. And under that, we have Babies Can't Wait, which is 0 to 3, and Children's Medical Services for chronic conditions of birth to 21 years. And we also handle early hearing detection and intervention. Lastly, we have AHYD, which is Adolescent Health and Youth Development, from 10 years to 19 years. So as you can see, we like to address all stages of life for children, starting from pregnancy, because pregnancy is really, determining, your life course up until 19 when we get into our teenage years. And all of those are very formative years. So I'm glad we have programs that can address all stages through that time frame. Purpose. This is the first one. Again, Mothers Offering Resources and Education. Our supervisor is TL, and the purpose is to increase the number of pregnant teens and women who receive pregnancy-related support, education, and resources. So whenever we're out in the community or we have a pregnant client come into our facility, we want to make sure we're giving them enough resources so that they can have a sustainable pregnancy and even giving birth, have enough support through us in the community. What are factors that affect maternal and infant health? First one, educational level. That's a big one. Health literacy is very important. We can't just always go off of common sense or what people know. There's also a lot of misinformation, and people may not have the knowledge or background to even understand health needs. Why is it important? Why is smoking in the home bad for children? Why is drinking while pregnant bad? Why is safe sleep important? So educational level is important, as well as insurance status. People may not have jobs that offer insurance or qualify for insurance. So that affects if people are receiving care, right? Also, income level, that goes hand in hand with insurance. Some jobs may not offer the insurance, or some people cannot afford to go to appointments out of pocket. So that's a big one as well. Housing quality, I talk about that a lot. There's still people living in homes with lead, so we do have a lead program separate from ours that covers that. Also, I would say alongside housing quality would be smoking in the homes, violence in the home. Do you have a safe sleep area for your child? So all of that I would put under housing quality. Transportation challenges. We do have clients that don't have transportation, don't have cars, don't know people with cars, they don't have a support system here in DeKalb County. So that is also a major challenge. How can we get them to and from their appointments, to and from the hospital? That's a big one. Lack of access to medical care, again, transportation, but also just is there a facility nearby to you? That's also a challenge in some areas, more so in urban populations. Rural, that's a problem. And lack of social support. We have clients who have 3, 4, 5 children. How can they, take all of their children just to go to one appointment? They may not have the social support. They may be working overtime to pay the bills. It can be hard for them. So lack of social support is also a big one. Eligibility for the MORE program. Pregnant teen or woman and a mother with an infant under 1 years old. Services. This is our supervisor on the left, TL, and two of our MORE mothers. Once our clients come in, they get assigned a MORE mother who's going to help them with their services. And so we offer classes, again, classes on safe sleep, nutrition, breastfeeding, anger management. We also provide resources on education, people who go back to school, employment, mental health, and financial literacy. Our doula services are also very big for our pregnant mothers. So this is the kind of social support also that we're building for our mothers who may not have social support, or even if they do, it's good that we have this service for them. These are classes again, so we want to talk about the different ages of your child as they grow older, stages, and where they fall along in that stage. Car seat safety, that is a huge one. We always assume that we know how to throw the baby in there, put the car in drive and go. But I watch videos all the time on TikTok and social media, and I see people with a chest clip and videotaping their baby, and the chest clip is down basically to their pelvis. That's not going to help anyone. And in a time when you slam on those brakes, the baby is going to fly out the car seat. So I'm very big on car seat safety. I also give away car seats. So in order to get a car seat from us and from our other departments, you have to take the car seat training course. Another class, I'm a parent now. What? That's a big one for people who may not have had the best examples of growing up or don't even know anything about parenting. Where do I start? So that's a good one. Newborn care, safe sleep, very big one again. ABCs, baby should be alone in their crib on their back. ABC. Additional classes, anger management, breastfeeding. We all know the benefits of breastfeeding for your children. If you can breastfeed, nutrition, and that's why we have WIC, so we can provide pregnant mothers with the necessary vitamins and nutrition they need, and postpartum depression. WIC, again, this is the one I feel like people are most familiar with when they hear about our services. Our supervisor is Courtney Underwood. Our purpose is to safeguard the health of low-income, pregnant, postpartum, and breastfeeding women, infants, and children up to age 5 who are at nutritional risk. Eligibility, you have to meet the income limit set by the WIC program. This is, specifically for DeKalb County, and those limits change and it varies upon your county. All the counties in Georgia will have WIC, but this is just for DeKalb. So you can look at your families and see if they qualify. Again, you have to be at nutritional risk and pregnant, postpartum, or breastfeeding. And you're also eligible if you're infant up to age 1, child up to age 5, or if you're a father, caregiver, if you're just a provider for a child up to their 5th birthday. Benefits. So you will receive an EBT debit card to purchase supplemental foods. It'll show you what foods you can and can't get. And I know even at Kroger and Walmart and other places, I'm sure it'll say on the tag on the shelf if it qualifies for WIC. You'll get nutrition education, breastfeeding support, referrals to healthcare and community services, and there's an annual farmers market. We have it here at our clinic, and I know North has one as well that families can come in and shop from the farmers market. Now we're getting into our early intervention programs. This is Children's First, again, the umbrella program that we kind of really start off with. And then from there, we decide, do they need to go into Babies Can't Wait? Do they need to go into CMS? And sometimes children qualify for both, actually. And then attached with that is early hearing detection and intervention. Medical and environmental factors can increase risk of a developmental delay or chronic health condition. This including prenatal factors like substance exposure. So again, drinking, smoking, vaping, birth factors. How did your pregnancy go? Did you have a baby born preterm? Things like that. Infancy and childhood factors and prenatal family factors. So genetic predisposures, risk factors, things like that. Children First, our supervisor is Aletha Dixon, and the purpose to identify, screen, and link children's ages birth to 5 who are at risk of poor health and or developmental delay. So for the referral process, anyone can refer a child. I can, you can, Annette can, Jacob can. Anybody can refer a child if they have concerns about growth and development, including parents, healthcare providers, and agencies, which that includes us, anyone in the community. You just complete the screening referral form either online, by phone, or your local coordinator. I can email out the form actually so everyone can just have access to it. We just do ask that if you are going to complete the form for a family, you have to let the guardian know, because we are going to follow up, because we have to, right? So if we follow up and they have no idea what we're talking about, it's going to be a little awkward. So, maybe have the conversation with the guardian, or, just bring them with you here to us, and that we can do the whole thing together. So enrollment. So again, we'll have that initial contact. We are going to call. We're going to schedule a home visit or clinic appointment that will be here in this facility. And again, we'll assess the child and do the screening. So screening, again, there's an ages and stages questionnaire that we follow, and we look at a family's needs assessment. And then if eligible, we will link you to services, and the child will be referred. And then we'll monitor the child. So this is our early hearing detection and intervention program, and this is to screen for and serve infants with hearing loss birth to 1 year. If you didn't know, every child born in DeKalb County does get a hearing test in the hospital, and we're screening for hearing loss or within the first month. And for newborns who do not pass that initial screening, the program will follow up with that, and there will be a referral for rescreening. Babies Can't Wait. Purpose, we offer a variety of coordinated services for infants and toddlers with special needs and their families. Our supervisor is Ellie Gonzalez. Eligibility, have a diagnosed physical or mental condition that's known to result in a developmental delay, such as blindness, Down syndrome, autism, or spina bifida, or you can have a diagnosed developmental delay confirmed by a qualified team of professionals. So services, again, we do the free evaluations and assessments. Every child that's referred to us, we do have to follow up on. You can receive occupational therapy, just depending on what the needs are. Physical therapy, psychological services, speech language therapy, behavioral. It all just depends on the child's needs. These are just photos from our fall festival. We have a fall festival every year. I think this was in a parking lot of our North Center, and we have a clown that comes and paints the kids' faces. We do balloons, diapers, giveaways, all that jazz. So this is from that in 2023. Children's Medical Services, our supervisor is Patrice Cannon, and the purpose works with healthcare providers and community partners to ensure children with chronic medical conditions have access to timely, quality healthcare. So CMS has over 600 conditions that qualify for. You can just take a look at some of them, but there's a full list of them, some that I've never heard of, and just very detailed. So this includes heart conditions, cerebral palsy, diabetes, Down syndrome, hydrocephalus, seizure, scoliosis. So there's just a long list that you can qualify for this program for. Services, assistance with child-specific healthcare needs, and that includes, medical services and or medical equipment that's not paid for by Medicaid or private insurance. In the past, I know we've given out wheelchairs, hearing aids, things of that nature that can help the children's life, quality of life. Transition planning for adolescents 12 years of age and older, because it is up to age 21. This is just a table. I do a table in our center almost about every single month, just highlighting awareness months. In December, it was Safe Toys and Gifts Awareness Month, which is big for December. Everyone's giving out toys and such. So I wanted to make sure people knew about helmets for bike safety, water beads, how dangerous they can be, and the button batteries. This month of January is National Birth Defects Awareness Month. And I'm highlighting CMS because they're more so chronic conditions and birth defects. This table is highlighting orofacial clefts of the lip, cleft lip, cleft palate, spina bifida, and congenital heart defects. All these conditions are birth defects, so the child is born with them, but that doesn't mean that they always appear at birth, right? We hear of people getting diagnosed with heart conditions later on in life, usually during emergencies, like, when the football players pass out or pass away, unfortunately, because they had an undiagnosed heart condition. So this is very important. And it's also important for pregnant mothers to take folic acid to decrease the risk of getting neural tube defects, which is anything along the spine. So adolescent health and youth development, our supervisor is Mariah Bridges Farner, and the purpose supports adolescents to develop healthy, educated, employable lifestyles as adults, aims to keep adolescents connected to their families and communities. Eligibility, ages 10 to 19 years old, and or participating in a youth serving organization, enrolled in child welfare or justice system. You can be pregnant or parenting, runaway, or unhoused. So we have a lot of different initiatives for our adolescents, personal responsibility and education program. We want to incorporate adult preparation subjects like adolescent development, healthy life skills, healthy relationships in community and school settings. I personally do go into the schools and do some education on things about that. A Step Up, Step In is also within our high schools in DeKalb County, and we engage communities and schools to identify and stop sexual bullying between youth. And Step Up, Step In occurs in the month of October. So asthma control and self-management focuses in recognizing asthma signs and symptoms and managing asthma to minimize hospitalizations for ages 8 to 16. Asthma control is very big. It's a huge initiative for us, so we do really want to prioritize that. And this is at asthma program outreach. Our manager, Candace Buchanan, is there at McNair Elementary's back to school fair. So we do go to schools again and do different initiatives and education so that parents and guardians know. This is a flyer just from our fall festival that happened a few months ago in November, similar to the picture I showed you from 2023. And this was at Clarkston Hub, which is a resource area right around the corner from us, actually not too far. And they provide resources for the community. And they have a clinic in there, and next to it there's a daycare, Head Start daycare. So it's very much for the community. We love partnering with them, and that was a huge success. We did give away a ton of diapers. We gave away pack and plays, other types of packages. And there were a lot of partners and vendors there as well. And again, this does happen every year. So if you would like to come to the next one, you can email me, but I will let you know at the end about that. And that is my presentation. I know that there was a lot that I covered. We do have 6 programs. Again, they all have their own goals and purpose and eligibility requirements, but I'm just hoping that you guys understood basically the overview of it. And then if you need more information, or if you already have a family in mind, you can email me if you do have any questions. And this QR code, if you would like to partner with us, if you're having any type of event, it doesn't even matter if you have all the logistics down. If you already have a date and the time, you can go ahead and tell me about it if you want to get on the calendar with us, because the earlier the better. We do get booked up. So if you know time and date, just go ahead and email me, scan the QR code, and we can see if we're available to go. We do go to different events on the same day. That's fine, as long as we, have enough staff to do so. So that's why it's just the earlier the better. If it's anything for our target population and goals, which is, pregnant people all the way up to age 21, is fine with us. So anything regarding children or pregnant mothers, I go to churches, clinics, daycares, YMCA, Boys and Girls Club, all these different places. It doesn't matter as long as it's in DeKalb County. And again, if you want to partner with us for our fall festival and become a vendor, you can scan the QR code as well. And that's always in the fall. And then this is my email below if you just want to reach out with anything else, if you have any questions in mind. Does anyone have any questions?
Listen, thank you so much for your presentation, Taylor. Today, I did want to make sure that I could address any questions that people have. And one of the questions is when you educate families, what are some of the topics that you're educating them on?
Great question. So I would say, I guess it depends on the event, the age of the child. If it's a pregnant mother, it really depends. If we're talking about pregnant moms, the big one that I want to cover is safe sleep education. Even when I give out pack and plays as well, I do go over safe sleep. That's a big one. Again, we can't assume everyone understands safe sleep. I also talk about how when other people are watching your children, right? A lot of us have to go to work. I have to go to work. I have a toddler. I want everyone to know what safe sleep is. So I even educate parents on how when their parents are watching their children, what to look out for. Nutrition, I educate on nutrition. Car seat safety is a big one. So it really just depends on the target audience. If we're talking about adolescents, we cover all topics: internet safety, bullying, reproductive health, obviously, smoking, vaping, everything. We even partner with HIV team as well. So it just really depends on the target audience. But I would say no topic is really off limits. We've done it all. It just depends. Hopefully
Okay,
that answers the question.
okay. And then what ages are you seeing children? When do you know they're at risk? Who's actually reporting to you? How are you getting your information?
Awesome. So how do you know someone is at risk? So what we do is we have an ages and questionnaire. I can also email that out as well. And it's going to have the age. So let's just say a 2-year-old, because I have a 2-year-old. So it's going to say 2-year-old, and it's going to have questions. And these questions are basically going to assess whether your child is really on track for their age. They may be a little bit delayed. They may be behind. They may be on track. Everything may be fine. So the questions will say, are they using sentences with at least 2 words? Are they able to climb steps alternating feet? So it'll just ask different questions. Can they independently feed themselves? Do they say mama, dada? So we're filling out these questions with yeses, nos, maybes. You're filling out this questionnaire. And if it's coming back that there may be not be on track, they could be at risk. And again, we're not saying that anything that could be wrong or that they're delayed, right? But we do want to investigate and make sure that they're on track. Again, no one child is alike, and that we're all on our own kind of growth track, right? And you go to the doctor, you're on a growth track. So the one child, we just want to make sure that they're heading in the right direction. So that's how we can tell if they're at risk. And that comes with the assessment. So the first thing will be the referral. If I'm referring my neighbor and I'm thinking, hey, little so and so, he hasn't said a word to me, and I see him every single day, and he's 4 years old. That doesn't seem right to me. I can submit a referral again with letting the guardian know, hey, can we see about this? Just come with me to the clinic. It may be perfectly fine, but I think, we should go see about this. That starts with a referral. And then once we get the referral, we're going to call and say, hey, when can we set up a screening? And that's when the questionnaire comes into place, and we look to see if they're at risk. And then if they're eligible, we follow up from there with therapy, speech therapy, language, things of that nature.
Okay. So a child that is at risk and you follow up and have done the assessments and they need therapies, how do you find the therapist and
So, oh, go ahead.
cost?
I'm sorry.
Cost? rest the cost to the parent?
Right. So it just depends on the program that they're eligible for. We work with different insurance providers and Medicaid to make sure that, it's suitable for the family's needs. So it all depends on the program that their child gets eligible for.
Okay. Who helps with the cost? Just the parent, or are there scholarships?
To my knowledge, there isn't really scholarship. It's based off insurance, and we'll try to work with Medicaid for you. But I can't really see the chat right now. But whoever asks, I can follow up with you and get more information.
Okay. I do have a question that says, will there be a follow-up session on the other public health department? I think they mean the other divisions within the public health department. And also, what about employment opportunities?
Absolutely. So if you're talking about in maternal child health department in each one of the 6 programs, I would love to come back and go into way more detail about each one. Specifically, if your organization or whoever you're looking for is specifically looking for a different age group, within our 6 programs, I can do that. I can also refer, our other departments. We have several departments here at the health department, including HIV, vital records, where you get your birth certificates, things like that. We do immunizations, even for travel and things like that. Nursing. We have a lot of different departments. Environmental health. So if you want to hear from the other departments, I can send out a hey and see who would want to come and do the lunch and learn services. But if it's specifically maternal child health, I can definitely come back and go into more detail. And I also can do training on safe sleep and car safety as well during the lunch and learn. So you can scan the QR code and tell me what you're interested in, and I can come back and do that.
Okay, I appreciate that. I think it would be beneficial maybe to have a panel style lunch and learn with some of the other um, groups that you have, some of the
Yeah,
other
I think that'd be great.
offices that you have services. So
Absolutely. Oh, I forgot about the employment opportunities. Sorry.
yeah,
So we are always hiring. So if you go on, I think it's governmentjobs.com/Georgia DPH. That may not be exactly. So I would just type in, Google government jobs, Georgia DPH, and it should come up. And you'll see on there all the careers that are on there. We're also on LinkedIn. And yeah, just through the website, LinkedIn, maybe Indeed, I'm not too sure about, but I know for sure LinkedIn, and we post on there every single day. So that's how you can apply on the website.
okay. I don't see any other questions at this time. Is
Okay.
there anything else that you would like to expound on more? Or
I don't think so. Just thank you guys for having me. Thanks for coming. Again, I'm glad to kick off the first lunch and learn. I'm hoping to do a lot more. Every single time I go into the community and they recognize our department, I feel like that's great because I'm doing my job as the outreach coordinator. But I do realize that there's families, who are moving to DeKalb and are unsure about the services. So I just want to make sure that enough people, organizations, other partners know about our services so that they can reach out to the community as well. So thank you guys
let
for having me.
okay, let me just ask Taylor, because you do so much in the community, how do you outreach to the community? What are some of your methods?
Oh, great question. So some of my methods, I would say the most popular one is I just do a Google search and I literally will type in events happening in DeKalb County this weekend or in January, February, like that. And, they all just sort of pop up. And then I will reach out to the director or whoever's over it and see, hey, can I come to this event? And then once I establish that partnership, and that kind of leads me into a little roadmap to somebody else, and I meet someone else, I meet someone else. That's the most popular way. But also, since DeKalb Public Health is, well known and we are the health department, I get so many requests already that I don't even really have time to do that anymore because there's so many that's just pouring in and people are saying, come to this community baby shower, come to this Thanksgiving thing, and there's always something every month. So it turns out that I really don't have to reach out anymore. They kind of just come to me. So that's why it's good that if you do have something that may not be on the radar, it's good to just reach out to me specifically so I can make sure to put you on the calendar that way.
Okay, well, that sounds great. We are having a Human Services Day in 2026. We don't have our date yet, but probably closer to the fall. So, of course, we will reach out to DPH.
Absolutely, that sounds great. And then even if you want other departments there as well, you can just let me
Yeah.
know, hey, I want environmental health or I want HIV there because they do free testing as well. So you just let me know what other departments you want there. But definitely I have that on my radar.
Okay. Well, thank you so much today. Audience, thank you for joining us. I don't see any other questions. And with that, I'll just say have a great afternoon.
Thank you.
Okay. Bye-bye.
Bye.